On to the second PPT. So we'll be looking at the history. What are the roles of clinical psychologist? What are the assessments? Not only like the specific assessments, what is an assessment in general, and about clinical interview and how to diagnose based on the clinical interview. Okay. First, like the history part is that psychology has been there for a long time, but clinical psychology is like more of a recent field. So it occurred only in the 19th century. So we look at the developments that led to clinical psychology. So through two major schools, one is the psychometric school, which is basically testing, okay, and then the dynamic tradition, which is based on the Freud's psychoanalysis. So these two schools, one is the statistical objective testing, which led to a lot of assessments which are still currently used in clinical psychology, and about psychodynamic interpretations of various illnesses. So these two main schools were flourishing in the 19th century, so which led to the birth of clinical psychology. So when you look at the psychometric tradition, first we have Wundt's first laboratory in Leipzig, 1879. So this led to whole host of psychological testing. So then Spearman talked about the G factor of intelligence, which is the top, and there are very specific intelligences. So this led to various host of assessments. And then the testing movement began because of this particular development. So mental tests as a term was framed. This was done by James McIntyre. Okay, so this was in 1890. So this is also a possible MCQ question. Who framed the term mental test? Okay. So mental testing became one of the most important things, particularly during the world wars that we will be seeing soon. The very first intelligence test was done by Alfred Binet in 1905. So this was for the French government, where he tried to identify people who are slow learners. Okay. So this was to identify people who are slow learners or mentally retarded and help them learn much faster, or for rehabilitation purposes, or remedial coaching, you can say that. So his test was revised several times, and Lewis Terman adopted his test, Binet's test, into what we see currently as the Stanford Binet intelligence test. So Lewis Terman was working in Stanford, so he adopted it, and right now we have the 5th edition of Stanford Binet test. So at the same time, David Wechsler, he also created the adult intelligence scale and also the intelligence scale for children. So he also created another scale which is for preschool children. So he kind of has 3 scales: adult, okay. So and then we have adult, intelligence scale for children, and a scale for preschool children. These all measure intelligence. So when you come to the dynamic tradition, you know, it's Sigmund Freud who started the psychoanalytic movement and the role of unconsciousness. So there are further psychoanalysts who spread out from Sigmund Freud. So even though Freud was a medical practitioner, neurologist, his theories have most influence on psychology rather than psychiatry. So right now, psychiatry is more about diagnosing and treating via medical methods or biological methods, even though they say it's biopsychosocial factors. His theories have had a lot of influences in psychology per se, rather than psychiatry. So this led to the birth of clinical psychology. So initially, clinical psychology was more towards treating children or helping them rehabilitate, because most of the assessments started with helping children and helping people with mental retardation and in their remedial training. So in 1986 is when the first psychological clinic was established. It was by Leitner Whitmer. So he is also kind of considered the father of clinical psychology, or you can say the founder. So this is also a very common question in a lot of tests: who is the founder or who is the father of clinical psychology? So the answer would be Leitner Whitmer. Okay, and he happens to be a student of James Cattell. So in his clinic, so he was primarily working in the area of testing, basically assessments, and particularly for education of children and making them rehabilitate into the community and such things. But later, because of the onset of World War and other things in the next few decades, what happened was testing as well as psychotherapy became prominent. And earlier, before the World War thing, psychotherapy was something considered to be only be done by the medical professionals. So it was not a role of the clinical psychologist or psychologist per se, because Freud was a neurologist, right? So most of his peers were from the medical profession. So the predominant model of therapy was psychodynamic. So it was predominantly practiced by a lot of medical professionals. So the transformation began from pure assessment to therapy is because of the World War events. So in the First World War, it was still based on assessments, where the Army Alpha and Army Beta group tests were used to put people into various categories or cadets based on their level of intelligence, and also a personality test. Okay, a personality test called Woodworth Personal Data Sheet. So these were created especially for the United States Armed Forces. And other projective tests were also provided. One is the Rorschach ink blot test. We already know there are 10 tests, 10 ink blots based on which diagnosis as well as personality can be assessed. And we also have the thematic apperception test, which is another projective test. These also developed at the same time or around this time. So clinical psychologists became to be known as psychodiagnosticians. So this is also one of the ways in which we are practicing right now. As in, the first year of your training in most M.Phil institutions will be to train you as psychodiagnosticians, and in the second year, most people will be trained in therapy. Okay, so we still see this formality happening right now. So only in the Second World War, so did people or clinical psychologists get into therapy. So as I told you earlier, psychotherapy was something that was practiced predominantly by the medical field. Okay, so it was limited to physicians. So World War II, because of this exponential change, people are having flashbacks, basically because of PTSD and anxiety and other things from the World War. So they felt understaffed, and a lot of psychologists have to be drafted into the armed forces, not only for assessments, but also for the other clinical roles, such as providing therapy, right? So the needs of thousands of psychological casualty as in this flashback being, having all this conversion disorders and things, led to the requirement for clinical psychologists. Okay. So a lot of restrictions were put based on how they should practice, but the restrictions were lifted at the same time, and they started practicing therapy in this time. Okay. So in the post-war period is where clinical psychologists were established as therapists, and they started using more and more approaches apart from just psychodynamic. So that is where you had the birth of cognitive behavioral therapy, or behavioral therapy was also there simultaneously. Humanistic psychology and even family systems therapy started emerging in the 20th centuries. So they started using these approaches as well, along with the psychodynamic, which was prevalent at that time. Okay. So any doubts or questions right now? Is it clear so far? We'll move forward.
Yes. I just have one question. As it is saying, the slide is saying that prior to World War II, clinical psychology was not recognized. So, in World War II, was like psychodiagnostic factors and psychodynamic approaches were more often used, or was it only based on intelligence tests and personality tests?
Psychodynamic factors were still used, okay, but it was more restricted to formulating why a person has a particular disorder and why is this person this particular way. So still restricted to more assessments. And you see, psychotherapy was kind of only acceptable to be practiced by physicians because of the factors I told you, because Freud was
Hmm.
a neurologist, so he was from medical background, and his peers were from the medical background. So it was predominantly practiced by them. Psychologists, because of the first part of thing, psychometric tradition and their expertise in psychometrics, kind of restricted to assessments. There was no need also. So there was a clear cut, okay, medical professionals are practicing therapy already, and there was this upcoming tradition that, or trend, that some people are practicing testing. So the distinction was quite clear then, until the need arose in World War II, when there were like a lot of psychological casualties. So then the medical staff felt overwhelmed. So they recruited psychologists not only for the assessment role, but also for the therapy role. So they were anyway kind of like reading on Freud also, because they are using those things also in their assessments, right? So it is not only purely intelligence tests, they would also be doing projective tests, which is based on Freud's theory. Projection is a defense mechanism, right? So using those defense mechanisms, so they would be using it to assessment. In World War II, they started using it for therapy as well. Okay. Hope that
Right.
clarifies a lot of things.
Yes. Thank you.
Cool. Okay. So we'll move on to post World War period. So what happened was, clinical psychologists' repertoire kind of increased. It was on assessment as well as diagnosis and treatment. So along this time, just after the World War, there was this lot of bodies which started giving what we have as DSM, and also we have the ICD, right? So there was a requirement to classify mental disorders, and clinical psychologists were a part of it. So the repertoire was not only assessment, it was diagnosis as well, and even in treatment, more psychological treatment. So because of the need that was felt during the World War, so the Veterans Association asked the APA, American Psychological Association, to specify what are the requirements to be considered a clinical psychologist. So they have to go to various universities and visit their doctoral programs to see what level of training is required to be considered a clinical psychologist, and to standardize that. So the committee, the APA committee, was asked to outline a model of training program and the standards for selecting students for such program, as in basically like how we have uh, you know an entrance test, or master's level students can come into this, or the new proposed one that should be a 4-year bachelor's. Okay. So such standards were set by the committee. First they explored and then they set it. So the APA committee on training in clinical psychology published a report. So what is known as the Shako report. Okay. So this report was kind of used as a guideline initially, but later it was standardized also. Anyway, so we'll look at what the report was. The clinical psychologist has to be trained as a psychologist or a practitioner. So the training program should be rigorous as a doctorate level. Not only clinical skills, they should also have academic and research skills. Okay. So this is the reason it came to be known as the scientist professional model. So they should have the research skills and also the clinical skills. So this was the proposal from the Shako report. Okay. So they recommended that clinical psychologists should be trained for 4 years at a doctoral level, and first 2 years in more of theory studying, and also in terms of assessments. Third year in a complete internship in a hospital, and then final year in their dissertation. So they should be trained across the three things of assessment, diagnosis, and treatment, which came to be known as the Holy Trinity. Okay, assessment, research, and treatment. So the curriculum covered 6 major areas: general psychology and other related disciplines, and psychodynamics of behavior. Other related disciplines would be psychiatry, behavior medicine, or health psychology, and other things. So what are the psychodynamics of behavior? So basically, because of psychodynamics predominance in the birth of clinical psychology, this was one area. Diagnostic methods, so basically your assessments and how to reach a diagnosis, research methods, and lastly, therapy. So other recommendations for this is discontinuation should also happen at master's level, need not always be a full doctorate level. It can end at the master's level too. So that was one of the recommendations. And it should be mostly based on practical training rather than just university level classes and just theory level training. It also should encourage self-evaluation. These are like kind of pretty self-explanatory. So Shako report became a guidelines, and soon it was used as a Bible to create a lot of syllabus. So after the Shako report was presented in 1947, 2 years later, there was a conference at Boulder. So hence the Boulder conference, and it was kind of approved. Okay, so 2 years after Shako report, the report was formally adopted. Okay, so this model came to be known as scientist professional model in 1949 based on the Boulder conference. So this is still the basic approach based on which we are creating the syllabus. So we are professionals, also we are scientists. So we are also doing research. Okay, so the Boulder model has training based on this thing. But there are also a lot of criticisms. So one is that a lot of people do not actually like to participate in research. Okay, so students kind of despise research, and it is also kind of not possible within a short time frame, let's say 2 years, if you're considering a master's level degree, to train people in both scientific rigor as well as the clinician based components. It's like less time period is there. Okay, so a lot of people noted that there may be a separate training that could be required. So hence they had another conference in Vail. So there also they reached the same conclusion that both clinical training as well as research training is kind of overloading. A lot of people kind of do hate clinical training. There should be a choice, and also it should be about more clinical focused. But still, we do practice this scientist professional concept only in India and even in most of the places. Okay, so very few places focus predominantly on only practice. So the Vail conference proposed a scholar professional model. It's kind of the same thing. So Gordon then Derner used this term scholar professional model for this new model of training. So where you should have extensive clinical practice right from the first year, and it should be supervised. Okay, so there should be some scholarship in terms of being trained in the current literature, not for research purposes, but to gain more clinical knowledge of what it is currently used. And that literature should be relevant to the person's career goal, not necessarily to just push out papers, not necessarily to just do research. So it should be based on the goal of clinical service rather than just research. So it has a lot of focus on clinical service, and reading literature should be aiding this clinical service rather than just for research purposes. So several strategies again were proposed. So Derner proposed that it should be at least a PhD, so that a person can get both this academic achievement and also be clinically trained. But a lot of people felt that PhD is so very research oriented. There should be another new degree at doctoral level, and they call it the PsyD, or Doctor of Psychology. So this is what is present in most places. Like if you look at America, so you have Doctor of Psychology, which is PsyD. In the UK, you have something called D-Clin-Psych, Doctorate of Clinical Psychology, and in India also we do have PsyD. Okay, so this is predominant, and D-Clin-Psych kind of is different in terms of being a 3-year course. So it is prevalent in most English-speaking countries, UK, New Zealand, and even Australia, I believe. Yeah, Australia also has D-Clin-Psych, and US has PsyD. Canada, I think, has PhD is acceptable, but it also has some PsyD programs. I'm not sure about Canada though. Okay, but anyway, so this is based on the Vail conference. There are some countries and institutes which have adopted the scholar professional model as well. Okay, so any doubts in history of clinical psychology so far? Is it clear? So common questions you can expect is, so what is the current model for training in India or M.Phil Clinical Psychology? So the answer would be scientist professional, not scholar professional. Okay, and which conference led to the conclusion of making a scientist professional model? So that would be Boulder model, not Vail model, not just Shako report. Okay, so it will be the Boulder conference. So that could be one possible MCQ here. Any doubts or anything you want me to repeat here?
I want to ask
Divya?
something.
Yeah, sure.
Yeah. So in India, SID has already started, but is it like acceptable when it comes to jobs and other opportunities?
Yeah, sure. Because it is also based on RCA. RCA does recognize ID, right? But it is very unpopular. Just that like only 3 institutions are offering. Amity is one. I mean, 2 Amities are offering it, and one Speaker Academy. Okay, so it's not that popular. It's particularly not popular because of the sheer overload of work. So M.Phil itself is a burnout for a lot of people. So imagine doing it for twice the amount. 4 years you're going to be in rigorous training, and also you have to come out with a dissertation in the last year. So that is like a lot of commitment. So M.Phil itself is a lot of commitment for a lot of people. So PsyD is again even more hectic. That could be one of the reasons, according to me, is why it's not popular. But from a job perspective, it is valid because it is licensed by RCI. You even
Right.
have lateral entry.
Mm-hmm.
So, yeah, if you have done your M.Phil, you can enter PsyD at the 3rd year. Okay, so that is also one option that RCI and even the earlier UGC has made. So even the current NEP follows the same thing. If you're done your M.Phil or in the upcoming years MA Clinical Psychology, you can directly join the 3rd year of PsyD. Okay,
Okay.
so it is
M.Phil also has dissertation in the second year, right?
yes. So not just second year, in first year we'll propose the dissertation and then start working from second year.
Okay, okay.
All right. Anyway, so we'll stop the recording for this part and restart.